Good morning, welcome, and thank you for joining us for our first Live with LifeLink panel discussion for the month of August. To our viewers watching live on Facebook or YouTube, or even those who will watch the recording of this video, we wish you a happy National Multi-Ethnic Donor Awareness Month. For those who aren't familiar with this observance, National Multi-Ethnic Donor Awareness Month is a national observance to bring heightened awareness to donation and transplantation in multicultural communities. So before we begin, if you're watching today and have a connection to donation, whether you're a living donor, transplant recipient, donor family member, caregiver, hospital, or even transplant staff, go ahead and light up our comment section and let us know where you're joining us from. So today is a special day as I am joined with Dr. Martin Aldana, who will be giving us a closer look at understanding chronic kidney disease, particularly in the Hispanic community. We'll talk about the causes of it, signs and symptoms, and also we'll be talking about more about the new program at Tampa General Hospital. So welcome, Dr. Martin Aldana. Dr. Aldana is a nephrologist for Kidney Transplant Program at Tampa General Hospital. Dr. Aldana completed his residency at University of Miami JFK Medical Center in Palm Beach, Florida. And after following his residency, he completed his fellowship in nephrology at University of Southern California Keck School of Medicine. And after all of that, he circled back to Florida to join the transplant program at Tampa General Hospital. Dr. Aldana is board certified in internal medicine and nephrology and is fluent in English and Spanish. Welcome, Dr. Aldana, and thank you for joining us today.
Good morning. Thank you for having me.
Yes, no problem. So again, as we're celebrating this
Hmm.
observance again, which is National Multi-Ethnic Donor Awareness Month, we want to bring more we want to bring more awareness to multicultural communities. And so the fact is, minorities often experience higher rates of diabetes, high blood pressure, and heart disease, which can contribute to organ failure, especially kidney failure. So, Doc, I want to jump right into the questions if you're okay with that. And I want to get let's I want the audience let us to what I want us to share with the audience about these questions. So the number one question right now, if you will, could you kind of explain to us what is chronic kidney disease and what are these symptoms?
So, chronic kidney disease, by definition, means the loss of the kidney function. And you can assess that by different means or ways. So, the kidneys are involved in different aspects or processes in your body. Hemoglobin production, the volume management, electrolytes, acid base. So, all these little things actually take into consideration when we're assessing chronic kidney disease. Um, in addition to that, it's not just by blood tests or urine tests that we can assess that, also by imaging. So we also may need to make sure we assess how the anatomy of the kidneys are. So all those things putting together, it's first of all the way to assess kidney function or the process in our body. Once you start losing that function or all the other things that the kidneys are involved into, then you can start talking about kidney disease.
Okay, interesting. Okay, got you. So now I know the symptoms to look out for, right? So basically, could you break it down to me? So now I know about chronic kidney disease. How could we treat the kidney disease? Is it curable? How can we remedy this disease?
So going back to your first question, I think I didn't answer the full question. So in terms of signs and symptoms, it can be something very very subtle, uh, like not feeling just well, or having low energy, poor appetite, nausea, vomiting, seeing certain things in the urine like bubble urine, frothy urine, and again, it depends on what's the cause. Okay,
Hmm.
in whether or not this can be treated, going back to what I was saying, it depends on what's causing the kidney disease. You can go from a broad spectrum from being overweight, diabetes, high blood pressure, certain autoimmune diseases, medication, either excessive medication or not taking enough medication. Everything can contribute. So depending on the factor of the cause, hence the treatment. Um, and unfortunately, kidney disease can be a progressive condition. So also how soon, how early you detect the condition or what's causing the damage, you can tackle that particular problem and either make the problems improve or resolve, or at least slow down the progression of the kidney disease.
Oh, okay. Interesting. Interesting. Okay. So when we, again, going back to, we're celebrating National Multi-Ethnic Donor Awareness Month, and we're highlighting those within our multicultural communities. Specifically today, we want to focus on Hispanics. And as far as it relates to kidney disease, could you share with us why are Hispanics at a greater risk of kidney failure than others?
So, being a minority in this country, or at least the largest minority in this country, um, Hispanics are more prone to certain genetic conditions and also certain socioeconomic conditions. So I think everything put together actually makes them more prone to kidney disease. We're talking about diabetes,
Mhm.
overweight, uh, probably lack of getting into the healthcare system, or inability to actually get into the healthcare system, uh, language barrier, lack of information, uh, heart problems, all these little things actually factor into why there is such high risk of getting kidney disease.
Okay. And so then as you just answered that question, it allows us to segue into my next question I have for you. When we talk about why Hispanics are at greater risk, do you mind sharing with us about the newly created Tampa General Hospital Hispanic Kidney Transplant Program that was just launched and created?
Yeah, so we've been working on this for quite a few years now. TGH, or Tampa General Hospital, they've been working very, very strong into launching this program. So back in February, we officially launched the program, as you were saying. The main purpose of this is to narrow or close the gap between this minority group and the entire population. And I see this as a step into closing the gap with every other people, every other background or ethnicities in this country. So we're very excited because it allows us to, first of all, giving information in Spanish, having the patients, their families getting involved into their care, and also feeling comfortable enough to have all this discussion in their own language by people with the same background. So it's been a lot of work. It's been very exciting. Hopefully, within the next year or so, we have numbers to back things up. But I think we're doing a good job. And again, having TGH backing us on this, it was a big deal. It's very important.
Definitely, I agree. It's definitely important when we discuss this. It's a sensitive topic to discuss, and of course, as you all see on the slideshow, it's a culturally sensitive program that provides individualized patient care for Hispanic patients throughout their kidney transplant journey. So it's definitely an important topic to discuss. As far as I know, for speaking on behalf of LifeLink, when we share about registering to become an organ and tissue donor, we also want to let them know. Also, share your wishes with your families, right? Dr. Aldana, could you share how do you educate not just the patient, but their family as well about the transplant process?
Okay, so coming from a Hispanic family, we're usually very large families. Okay, so having everyone involved into the care, it matters. You gotta take into account that your grandmom's always gonna have something to say, your aunts, your parents, your siblings. And it's not just by what they want to say, is that they also want to take care of you and go through this process with you. So involving the whole family, we thought was very important because, first of all, they're going to be the ones taking care of the recipient or the patient getting the kidney. Second of all, there could be potential donors. They're also going to be helping out. Let's say the patient have children or spouse, or more things that they have to take care. Having a big family helping them out through this process, it's important. Having someone to keep an eye on the medications as well. This can be a very overwhelming process. So the more help you have, and especially your family, we feel is it's the best thing to do, to tell the truth.
Couldn't agree with you more. And so, alrighty, so Doc, I have one last question for you. To sum up all of what we discussed today, and as you shared with the program, the TGH that you all just launched, how can we all better serve and educate the Hispanic community about kidney health?
Well, first of all, letting them know that there's such a thing as kidney disease. People usually don't realize they have any kidney problems because the kidneys don't hurt, except for certain specific conditions. And when we see them, or unfortunately when we see them, it can be quite late. So there's not much room to actually work or help them. Besides guiding them through the journey of dialysis, then transplant. So I guess spreading the word that CKD or chronic kidney disease is it's a problem out there, and it's related to a lot of other conditions such as blood pressure problems, diabetes, and overweight, which is three of the main conditions in this country. Uh, Patients who have had malignancies or cancer due to per se the cancer or chemotherapy, they can be also more prone to have kidney disease. So just making people aware that there's such a problem, it's good enough. Um, in general, moving forward to transplantation per se, letting them know that there's a program, or at least here in Florida, there's a program that would actually guide them through their process in their own language. I feel it's going to be a game changer. It's going to be very key for them.
Thank you. And I agree. Just bringing more awareness and addressing the problem, and also the saying, when you know better, you do better, right?
Correct.
Well, thank you, Dr. Aldana, for sharing this insightful information with us today. I feel like I've learned so much, and I'm excited to see the continued growth at Tampa General Hospital's Hispanic Kidney Transplant Program. So, for those of you watching online, thank you for tuning in for our panel discussion. As a reminder, if you are interested in registering as an organ, eye, and tissue donor and you're watching from Florida, Georgia, or even Puerto Rico, please visit lifelinkfoundation.org. Click on the yellow tab on the right-hand side that says Say Yes Today, which will navigate you to your local state registry and allow you to sign up to be a lifesaver. Now, guess what? That registration doesn't stop there. After you registered, please be sure to share your donation decision with your friends and family. So keep up with us all month long as we continue to celebrate National Multi-Ethnic Donor Awareness Month. Again, I am Bria Herring, and we'll see you next time. Thank you.